Hey everybody, Dr. Jeff Banas here with the Eye Centers of Racine and Kenosha in southeastern Wisconsin. I want to take some time out today to discuss with you something that I'm very passionate about treating in clinic, and that's managing visually significant floaters and discussing with patients our surgical options that are available to us now and to our patients to really manage that. You know, if you were sitting here as a patient, or if you had a patient sitting in the chair similar to how I'm set up right now, you might have your patient read that chart across the room. They'll tell you that, I can read those letters. My vision is very good overall, but I got this thing moving around. Imagine if I did this throughout my vision, and even though the vision's still good and they can see pretty clearly, that's pretty irritating and annoying. I think conventionally speaking, most of us were trained that floaters, unless they're associated with something emergent like a retinal detachment or some underlying systemic disease like diabetes with a vitreous hemorrhage that isn't clearing, there's not much to do about floaters, and leave them alone and let the patient neuro-adapt, no harm, no foul. And I think, that still is true, but just like cataracts are a normal age-related change that we don't ignore, we really don't have to, and we shouldn't ignore clinically significant or visually significant floaters as well. There's great options that are available to our patients out there surgically. Now, I would still say give your patient time to neuro-adapt to a new onset floater if there's nothing else, emergent or serious going on that's associated with the floater. And if they neuro-adapt to it, great. Move on, everybody's happy. But if that floater is still visually significant, is persisting, and it's really irritating them, you could send them to your vitreoretinal colleague for a traditional 3-port vitrectomy. YAG laser vitreolysis is something that we widely employ in clinic here too, so we can break up that larger floater or move it, displace it, vaporize it completely. It just needs to be in a safe location, so away from the retina, away from the back of the lens, and we can easily treat that. And then something that we're studying widely here in our clinic and employing as well is called the one-step LVR, limited vitreous removal. Think of this essentially as a partial vitrectomy. I'm not going to get into all the details of what we do there, but it's a less invasive form of vitrectomy where we're essentially coring out the central vitreous, and we can really easily remove a lot of those larger amorphous clouds that move in and out of the vitreous. And I can tell you firsthand experience that our patients are astounded by this. They do really well with it. It's a safe and effective procedure. And patients are ecstatic afterwards. So don't just ignore those floaters. Look into your options that you have available to you and get your patient to one of your surgeons that are doing any of these procedures to really let them decide what's the safest option. But there are many things that we can do nowadays. Thanks everybody. Have a good afternoon.